Today we will see about hypercalcemia. So this is another electrolyte abnormality which can occur, and today we will see in short about what are the etiology and what are the clinical features and how to evaluate for hypercalcemia, and also what is the treatment of hypercalcemia. So first we'll see the definition. Hypercalcemia is the serum calcium level more than 10.5 milligram per deciliter is called as hypercalcemia. And primary hyperparathyroidism and malignancy are the most important causes of hypercalcemia in more than 90% of patients. If there is hypercalcemia, these are the two important causes: primary hyperparathyroidism and any malignancy, which can lead to hypercalcemia. We have to keep this in our mind. Next is etiology. First, it can be due to increased bone turnover. Can be due to primary hyperparathyroidism, secondary hyperparathyroidism, malignancies like lung, breast, kidney, multiple myeloma, thyrotoxicosis, and sometimes in lithium therapy. There is increased bone turnover. Second, it can be due to increased intestinal absorption. You can see it in vitamin D intoxication, milk alkali syndrome, and granulomatous disease like sarcoidosis. Thirdly, it can be due to decreased renal excretion due to familial hypocalciuric hypercalcemia, thiazide diuretics, and acute adrenal insufficiency. So these are all causes of hypercalcemia. Excessive parathyroid hormone production due to primary hyperparathyroidism, some malignancies, multiple endocrine neoplasias, main syndromes, where there will be hyperparathyroidism, tertiary hyperparathyroidism, in renal insufficiency, ectopic parathyroid secretion, mutations causing familial hypercalcemic hypocalciuria, and hypercalcemia of malignancy due to overproduction of parathyroid-mediated peptide, many solid tumors of lungs, lytic skeletal metastasis, excessive vitamin D, 125 dihydroxyvitamin D production by granulomatous diseases like sarcoidosis, tuberculosis, leprosy, lymphomas, vitamin D intoxication, and primary increase in bone resorption, and hyperthyroidism, Paget's disease, ketogenic diet, excessive calcium intake, milk alkali syndrome, total parental nutrition, other causes like endocrine disorders, adrenal insufficiency, pheochromocytoma, medications like thiazide diuretics, lithium, vitamin A, excessive mammary parathyroid hormone-related peptide production with pregnancy. And there might be pseudo hypercalcemia also, and William-Buren syndrome. So these are the list of causes of hypercalcemia. What are the clinical features? Mild hypercalcemia is 11.2 to 11.5 milligrams will cause vague neuropsychiatric symptoms, personality changes, or depression, peptic ulcer disease-like symptoms, nephrolithiasis, and fracture risk may be increased. But in case of severe hypercalcemia, it is more than 12 to 13 milligram. There will be lethargy, stupor, coma, GI symptoms like nausea, anorexia, constipation, or can be pancreatitis. ECG changes in hypercalcemia, bradycardia, IV block, and shortened QT interval. So an ECG can also give idea whether there is hypercalcemia or hypocalcemia. And investigations are like electrolytes, we have to do blood urea, nitrogen, creatinine, renal function test, phosphate levels, serum protein electrophoresis. This is for diagnosis of multiple myeloma, and intact parathyroid hormone levels to detect hyperparathyroidism. These are the basic investigations which can give a clue to what are the causes of hypercalcemia. So coming to the treatment is like mainly isotonic saline, hydration 2 to 4 liters per day initially, and after hydration we have to give loop diuretic like furosemide 20 to 160 mg IV 8 hourly after there is volume expansion. This will lead to correction of hypercalcemia. We can use serum calcitonin, salmon calcitonin in a dose of 4 international unit per kg sub 12 hourly. Then we can use pamidronate bisphosphonates like pamidronate 60 to 90 mg IV over 24 hours. We can use plicamycin 25 microgram per kg IV over 4 hours, 6 hourly for 3 to 4 days. And corticosteroids can be used 200 to 300 mg of hydrocortisone every 6 hourly for 3 to 5 days. And gallium nitrate in the dose of 100 to 200 mg per meter square for 5 days. So these are all therapies which can be tried in hypercalcemia. And to treat the underlying cause also in malignancy, hyperparathyroidism, vitamin D intoxication or drugs. So this is in short about hypercalcemia. Thank you.